Vanakkam. Welcome to this course on biomedical instrumentation. We have been looking at heart function, and in the previous video we looked at the 12 lead ECG or the Cabrera system and the detailed functioning of the ECG system. In this video we will look at the pathological heart valve function or heart valvular pathologies. We discussed in one of the previous videos there are two kinds of pathologies that could happen. One is blockage or stenosis, the other is insufficient coaptation or rather regurgitation, inability to completely close. So, imagine that you are having a ventilation system for a home whose doors, that is a one-way ventilation system. Let us say breeze is flowing from outside to inside, for example. If the door remains stuck, completely open or completely closed, or partially open or partially closed, it leads to a situation in which the entire ventilation of the room will have to adjust according to the point at which the door is stuck. The door may be stuck because of some, say, dust, for example. It has not been cleaned for a while and then the door is stuck. Once you clean it up, you can again open and close the door. But then in the valve, this is not so trivial. It is not like there is some dust that is there in the valves that you just clean up. It is not like that. What is the nature of these valves? The heart has 4 valves, 2 cuspid valves and 2 semilunar valves. The mitral valve is the bicuspid valve, is the only valve that has 2 cusps. The tricuspid valve is an atrioventricular valve, and the 2 semilunar valves, the aortic valve and the pulmonary valve, all of them have 3 leaflets or 3 cusps. They ensure, essentially the function is to make sure that blood flows in one direction. Unidirectional flow of blood is the goal. One way blood flow is the goal of having these valves. Essentially pathology means when these valves either become narrow and allow less blood, or leak. When ventricular contraction happens, the AV valve should not open. If that happens, that leads to a situation in which blood flows back to the atria from the ventricle. It is called regurgitation. Regurgitation means you eat something and then sometimes when you eat too much or when there is a health issue, vomit, that is regurgitation, right. When flow happens in the back direction, undesirable situation. This is essentially a major disruption of normal cardiovascular function. The first type of disruption or the first type of pathology is stenosis. In this situation, the valve fails to open fully. So, that means when it is supposed to open, when will the AV valve will open? When will the AV valve open? We saw in the previous one of the previous videos on Vigor's diagram. The AV valve will open when the atrial pressure is much higher than the ventricular pressure. That is what we saw. So, but the AV valve opens, but it does not open fully, leading to a situation in which blood flow is not as much as it should be. Blood flow is obstructed. Some amount of blood is not flowing because this is a timed sequence. After some time, the pressure will continue to increase and then the valve will close, but there will be insufficiency. It will not actually lead to a situation in which blood will be fully filled in the ventricle. So, this leads to increased pressure load on the chamber that is behind the valve, right. One of the major reasons for this stenosis is hydroxyapatite deposition or calcification or rheumatic disease. In some cases, in about 1 to 2% of the cases, it is due to congenital deficits. The other is the regurgitation or the insufficiency. In this case, valve does not close fully. In this case, when the AV valve, for example, does not close fully, when the ventricles contract, blood is supposed to flow through the aorta, some of the blood will also flow to the atrium, right. This leads to chamber dilation and essentially reduces pumping efficiency. In a very big way, it compromises on the ability of the system to pump blood into aorta and the pulmonary artery. Right. What are the various valves that can go wrong, and what is the effect of this? When the aortic valve is stenosed, then what happens? It essentially prevents blood from flowing completely to the body. Only some of the blood flows. That means that the entire body is receiving its nutrition and oxygen from this oxygenated blood. So, it blocks blood flow to the body, leading to a situation in which there is a left ventricular overload. Right. Now, that or if it is regurgitating, that is if the aortic valve has an insufficiency such that when the ventricles are relaxing, some blood flows into the ventricles from the aorta. Highly unlikely situation you would think, but it happens. That is backflow into the left ventricle, for example. This is characterized by its typical characteristic murmur in the second right intercostal space and the sternal border. When the pulmonary artery or the pulmonary valve is stenosed, then it essentially blocks flow into the lungs, leads to a situation in which the right ventricle is overloaded, because pulmonary artery sends deoxygenated blood to the lungs for oxygenation, and when it has to send, the right ventricle will have to pump more and more to send to the lungs. Right. Suppose it is regurgitating, it causes a backflow into the right ventricle from the pulmonary artery. Right. Again, in this case, the murmur is typically heard in the second left intercostal space. When the mitral valve is stenosed, this essentially blocks blood flow into the left ventricle, leading to an increase in the left atrial pressure, and when that is regurgitating, some backflow happens from the left ventricle to the left atrium. This is characterized by a characteristic murmur in the apex fifth intercostal space of the mid clavicular space. When the tricuspid valve is stenosed, it essentially prevents the flow of blood completely into the right ventricles, leading to a situation in which the right atrial pressure keeps increasing. Right. And when that is regurgitating, when the tricuspid valve is regurgitating, there is an amount of blood that flows back from the right ventricle into the right atrium, right, backflow into the right atrium, and this is characterized by murmurs that are heard in the left lower sternal border. These are the various murmurs that could be heard due to valvular pathophysiology, either due to stenosis or due to regurgitation. There are different effects. All these are relatively serious conditions. And what are the major reasons? We already saw this. Major reasons are due to calcification, rheumatic disease, or congenital defects. Okay. Not all murmurs are pathological. Sometimes young adults also show some murmurs. So, there are some variations of these that are there. Some other misconceptions that we may have is that the right side disease is less dangerous than left side disease. This is not true. Both are both have their own effects on mortality and their own this, and sometimes people think that stenosis and regurgitation cannot coexist. Sometimes there are some cases where stenosis happens and regurgitation also happens. A mixed valvular physiology, pathophysiology is found in some cases. And sometimes valve replacement is permanent and is a cure, complete cure for the disease. Actually, prosthetic devices also have their own limitations on how well they can function. The prosthetic valves also have limitations on how well they can work. That is the other condition. The other belief is that louder murmurs means worse disease. This is not always true. Sometimes even in less serious disease, louder murmurs may be heard. So, these are not perfect predictors of valvular pathophysiology. Okay. So, with this we come to the end of this video. In this video, we looked at heart valvular pathology and pathophysiology of heart valves. With this, we end this video. Thank you very much for your attention.